Good afternoon and welcome to this community briefing on COVID-19 and our local response. Joining me again is interpreter Frances Beaurivage. Thank you so much, Frances, for being here. And thank you to the media and to all the residents who are tuning in to learn more about how you can protect yourself, your loved ones, and our community during the pandemic. We want to remind everyone to visit our website at covid19.lincoln.ne.gov. At that site, you can find out more data about the cases and the testing that we are doing in Lincoln and Lancaster County at our online dashboard. And that dashboard is updated twice a day, once in the morning and once in the evening. To update you on our situation here in Lincoln today, we've had one additional individual test positive for COVID-19 here in our community today. The total number of individuals who have tested positive so far in Lincoln now stands at 157. Yesterday, Bryan Health and CHI Health St. Elizabeth drive-through testing sites completed 119 tests. Current capacity is 150. So this is progress. That's nearly 80% of available testing that was utilized yesterday. But we do want to get to 100%. So if you have symptoms of COVID-19, please do seek testing. We have tests available. Here to provide more details on the case today and our local investigations of other cases reported in the past few days is Pat Lopez. She will also be providing some information about how to get tested if you believe you may have been exposed to COVID-19.
Good afternoon. With the additional case today, overall Lancaster County is now at about 4.8% positivity rate. That's the number of positive cases compared to the total number of tests done. The state is up to about 14.8%, and the national rate is now at 18.5%. 4 Lancaster County residents are hospitalized at this time, and 1 is currently on a ventilator. The total number of confirmed COVID-19 cases who are currently hospitalized in Lincoln is 36, with 6 on ventilators. Nebraska now has 3,515 cases and 56 deaths. And again, one of those deaths was here in Lincoln. Of the cases we are currently investigating, 19 of those have been connected to the Smithfield Crete plant, and 1 is a household member of a previous positive case. We are still investigating the other cases, but they generally are community acquired and don't have the same linkage. We do expect some additional cases to be connected to the Smithfield area. We are working with Public Health Solutions to coordinate the response to mitigate the spread. And it's my understanding from the news releases today that instead of closing, the plan is working on a modified environment to remain open in some capacity. As the mayor said, the increased testing we have seen through the hospitals and drive-through testing sites has contributed to the growing number of cases. The number of tests available from the Public Health Lab and LabCorp is going up again from 150 to 300 in Lincoln later this week. The increase in testing is crucial to provide us a better idea of the extent we have community spread in Lincoln. Now that testing capacity is growing, we strongly encourage everyone with symptoms of COVID-19 to get tested right away. We want to remind you that the CDC published a new and expanded list of symptoms consistent with COVID-19. These include fever, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, headache, sore throat, and a new loss of taste or smell. If you're experiencing any of these symptoms, please seek testing. The process is safe and easy and starts with an online risk assessment at chihealth.com or bryanhealth.com. At this time, only those with an order from CHI Health St. Elizabeth or Bryan Health or from a doctor are permitted at the drive-through sites. And we again want to encourage you not to go to the emergency room unless it is a true emergency. If you need assistance getting access to testing, please contact us at the health department at 441-8006.
Thank you so much, Director Lopez. Yes, testing does continue to be a key in fighting this disease. The increased testing that Director Lopez mentioned becoming available later this week is so important, and that's because testing capacity is what drives the health department's ability to isolate sick individuals, to quarantine their close contacts, and thereby prevent further transmission of the virus. You can continue to help prevent further transmission of COVID-19 by staying home as much as possible, by washing your hands frequently, by keeping 6-foot distance between yourself and others, and by wearing a face covering, a cloth face covering when you're out in public. We want to continue to encourage everyone in Lincoln to observe the social distancing or physical distancing practices and precautionary measures that will help keep them safe and others safe throughout the pandemic. And during yesterday's briefing, we discussed some of the key indicators guiding our local response to COVID-19. Today, we want to share more details with you about one of those key factors, and that is the strength of our healthcare system here locally. We are so fortunate to live in a community with strong hospitals and incredibly dedicated healthcare providers. We want to thank all of them who work to support our residents' healing and survival, and who do so courageously and compassionately during the pandemic. A bit later in this briefing, we'll be hearing from some of our heroic hospital leaders. We will also want to just thank the public once again for the steps and sacrifices that they have made in order to prevent our hospital systems from becoming overburdened. You have made such a difference in helping our hospital systems and medical capacity to be strong. So what does it mean to keep a healthcare system strong during a pandemic? Among other things, it means that our healthcare facilities have enough beds, ventilators, and PPE to manage COVID-19 cases and potential outbreaks. The Lincoln-Lancaster County Health Department communicates daily with our healthcare system leaders, and the collaboration that has occurred to plan for any increased need in our healthcare system capacity has just been remarkable. Here today to begin the discussion of our healthcare system's capacity is Jessie Davey from the Lincoln-Lancaster County Health Department. Jessie will take us through a short presentation on how our public health officials and healthcare leaders partnered to build our local healthcare capacity to address COVID-19 for our residents and for those coming from other parts of our state to receive care here in Lincoln. And with that, over to you, Jessie.
Thank you, Mayor, Director Lopez. Good afternoon. The process of planning for a potential increase in positive hospital cases due to COVID-19 in our community has been a sobering one. As we were all hearing the increased numbers internationally, before we had any positives in our country, we began to look at what we needed to do locally to address it so that we would have the best outcomes possible. We had a couple advantages. One was our geography. Given where we were, we knew we would have a few weeks before we would see our cases here. And additionally, we had a very rapid response from our city officials, which quite frankly bought us time to do what many other communities have been unable to do, which was plan. And so we called our community partners together, including our hospital systems and other community partners. And we looked at three things. The first we looked at was our capacity in our community. Knowing that we may or may not have additional resources coming, we wanted to be sure that we could keep our healthcare professionals safe in the process of caring for patients. Additionally, we wanted to make sure we had the capacity to care for all of the patients we may need to. Lincoln and Lancaster County may have 300,000 residents, but we recognize that our service area is much larger than that, as large as 400 to 450,000 people. And so we wanted to ensure that we weren't caught off guard in case we needed to extend our care. And so looking at that capacity, we recognize that there would be areas that may be stressed and resources that may be stressed. And so lastly and thirdly, we looked at how we could collaborate to alleviate that strain, to address that. And so we looked at a collective approach and a plan that wasn't just something to sit on a shelf, but instead that could be immediately utilized. Our planning process is intended and has been looked at daily. We have regular meetings with our hospitals to ensure that we are looking at the right things. Some of the measures we look at daily are the number of hospitalized, new hospitalizations, as well as those patients that are on vent, who have been vented. And what came about was this organizational chart, this process flow chart, which may not look very pretty, but is very reassuring because what it shows is that we have a capacity within our city that can grow based on the need of our community. And while the numbers have remained encouraging in our community, we do also recognize that those may change. So our group, our team that met, made the commitment early on that anyone who was either pending positive or who was positive for COVID-19 would have a bed at one of the hospitals. And because we made that decision, then the next question was really how do we alleviate the pressure so that they can continue to care for those patients. The collaboration from the beginning has been incredibly encouraging and has created more than just a count or capacity, but increased capacity because of that collaboration. Additionally, we have the privilege of Director Lopez, who has strong relationships in surrounding health districts and who was able to, along with our hospital systems, ensure that we were working with other health districts to expand our capacity and also expand theirs while not in any way hurting them in their own planning. So we continue to look at multiple tiers. How can we continue to expand our ability to accept more patients in our city and county? And then really looking at how we can move patients who need to get a certain level of care to another level. And those conversations, again, have been happening daily. Additionally, though, we recognize that a surge, if it were to happen, would take put quite a lot of pressure on our medical providers. And so as such, we looked into how many medical providers do we have in our community. And encouragingly enough, we have over 7,000 medical professionals in Lancaster County. Because of our collaboration with the hospital systems and others, we're able to look at, in a moment's notice, using their communication systems as well as Lincoln Lancaster County's Alert Sense and Lancaster County Medical Society's listserv, we can contact very quickly and find out those who would be available to potentially serve. And so if you look at that as from taking a step back, you begin to realize that while we've weathered the storm well now, we can continue to weather storms as they may come, and that our capacity is really very strong. Thank you.
As Jesse said, the health department has had a strong relationship with our local hospital systems. However, over the past 6 to 8 weeks, our Lincoln hospitals and our public health systems have been working on a unified plan for preparedness and response to the pandemic we're experiencing. The coordination to make this happen has involved many players: local government, the health department, hospitals, surgical hospitals, elder care facilities, urgent care, homeless services providers, primary care physicians, and surrounding areas. Those local health departments and hospitals are emergency medical services, schools, and others. This constant communication has been vital. Both hospitals are part of the daily planning and updating of the current COVID-19 response. All players come together with a spirit of transparency and continuous collaboration. The overriding theme has always been what can be done to protect our community.
Thank you, Director Lopez, and thank you, Jesse. The chart that we've been making available on display just shows you how much thought and work has gone into making sure that no matter what stage of illness, what need of care, what level of need of care, that we are prepared to provide that here in Lincoln and Lancaster County. And I could not be more proud to serve alongside our local public health officials who have been entirely focused on keeping the public safe and healthy. And as a city team, we are so privileged to work alongside a medical community that relentlessly pursues excellence as it strives to save lives and heal the sick. Here to shed further light on the strength of our local hospitals, the work they've undertaken to get ready for COVID-19, and the planning that they are doing to get ready for the resumption of some elective surgeries, are Bryan Health President and CEO Russ Gronwald and President of CHI Health St. Elizabeth and Nebraska Heart, it's quite a mouthful, Derek Vance. Thank you both for everything that you do and your teams are doing to take care of people in Lincoln and beyond. And thank you for joining us today via Zoom. President of CHI Health St. Elizabeth and Nebraska Heart, Derek Vance, let's start with you.
Thank you, Mary. You hearing me okay?
Yes, thank you.
Okay. Well, I know it's been said, and I've said it before, but I just, as someone who's relatively new to Nebraska, I am just continue to be impressed with how our county and city health officials, the mayor, and the community at large has responded to the call to quarantine, to be safe, and to minimize the impact of this virus. I remember probably a month ago we were talking about a peak date of mid-April, and we're now looking at a peak date for Lancaster County of, I'm hearing, around the middle of May. So the fact that that is being pushed out is really, to me, a testament that these efforts are working, and really allowing our hospitals to be in a place where we can take care of patients as they come to us, rather than just being in a position of not having enough supply or capacity to deal with what comes through our doors. So we've been very blessed that way. A quick update on where we are at St. Elizabeth. Today we have 27 positively identified COVID-19 patients in our facility in various stages of the illness. 3 of those patients are on vents, which again is a positive sign. We've had as many as 8 or 9 on COVID patients on vents in weeks in the past. And frankly, we've not seen the conversion of patients from the hospital inpatient units over to the ventilator units that we thought we would see. So still danger there. We're still cautious, but feel very good about the number of patients that have been converted to ventilators at this point. So that's a good sign. The question right now is really preparing for Monday, May 4th, which was the date that the governor put forward last week as a possible date for hospitals in our state to begin elective cases once again at the hospitals, which is something that we've not been doing for well over a month here in Lincoln. These cases, I would say we use the word elective. Elective does not mean that they are not important. It simply means that they can wait, that they are not urgent, they are not emergent, and something that can be put off without harm. That said, we are looking forward to being able to do those cases safely and effectively when the time comes. And we are planning on Monday, May 4th, as the date to begin a percentage of, or a fraction of, what used to be known as a regular caseload for elective cases. So we will start gradually as PPE allows. We want to make sure that, as every hospital does, that as we begin these cases, which are very important cases to the community, very important cases to our physicians, and to, of course, to the hospitals, that as we begin these cases, we do so in a way that does not put our PPE in jeopardy, or any other supplies in jeopardy that we may need down the road. So that's something that we manage on a daily basis. We look very closely at. Every day we look at reports multiple times a day that will show us how many days on hand do we have of gloves, of masks, of gowns, those type of critical supplies, blood supply for surgery specifically. So it is our intent to begin those cases on Monday in a ramped down fashion, and then again look at these from a daily standpoint, weekly standpoint, as we begin to grow and gradually increase those numbers going forward in the weeks ahead. Understanding that we may have to go back the other direction. Just depends on what comes our way. One thing that we identified early on that we thought would be important as we start to bring these elective cases back to the facilities would be a negative COVID-19 test. That's something that we felt we wanted to do, and so what that will allow us to do when those patients test negative, they'll be able to come into the hospital and have their case really very similarly like they would have prior to COVID, knowing that they're a non-positive COVID patient will help preserve PPE all the more as they come into our facilities. I will also say, and I guess just thank the community and our surgeons up front as we start slow and ramp up. Good chance that cases will not be able to be put on quite as quickly as they're used to. We will do our very best to be accommodating while being safe and responsible in our usage of PPE and how quickly we ramp this up. So, Mayor, I very much appreciate the invitation and very glad to be on today. I'll go ahead and pause to let Russ talk or take questions or however you'd like to go.
Yeah. Well, thank you so much, Derek. We so appreciate everything the team at St. E's have done. And we appreciate you managing your PPE supply, because certainly that's been a challenge for us here in Lincoln, Lancaster County, is securing an adequate supply of that. So thank you for all the work you're doing to innovate and to try to accommodate the needs of our community. And now I would like to invite Bryan Health President and CEO Russ Gronwald to share a few words about Bryan's response and preparations for the future. So over to you, Russ.
Yeah, thank you, Mayor. You can hardly start one of these conversations without, again, acknowledging all of the tremendous collaboration that we've had across the community. As was mentioned, daily meetings with the health department, with St. E's, and our physicians volunteering their time on either a daily basis or an every other day basis. Nothing has been done without communication and collaboration with them. And I think that should be very reassuring to all of the folks around the community that nobody's being left out of this. I should acknowledge as well the police department, Lincoln Fire and Rescue, also being so helpful with our various places where we're doing screenings and other work that we need their assistance with. And as was mentioned by Jesse before, we don't serve just 300,000 folks, but a much bigger audience. And so we're working with hospitals, I know CHI as well, outside of the Lincoln area to make sure all of this collaborates together. When we started thinking about what we needed to do, the first thing was to really create capacity to make sure that we were in good shape to take care of folks with COVID, but also those individuals that we need to take care of just every day. Right now, about 2/3 of our hospital is still filled every day with folks who are not related to the pandemic. So we needed to very quickly understand what we were dealing with. And as was mentioned before, screening has become really the key variable in all of that. So the easy visit screening, the drive-through clinics that both organizations are doing, we now have a mobile clinic. And so every day now we can do at least 300 tests, and we hope to continue to expand that as the demand gets there for that. I think we've tested about 2,800 folks so far. The biggest breakthrough that we've had is when the FDA approved us to be able to do our own in-house patient testing for COVID, because for those folks who need to be hospitalized, if we don't know whether they're COVID or not, they could be taking up a valuable room that is needed for isolation patients. So now that we can, for those folks who need to be hospitalized, get that test turned around in a couple of hours, we can really create more capacity than we were able to do before. Ventilators, of course, and negative airflow rooms we've talked about before. Those have been really important. And I think we're now up to about 160 ventilators available to us, and a similar number of isolation rooms that we can use if needed. As we get ready to start the elective surgery time, we're really focusing on basically 3 S's: screening, separation, and safety. We're going to be going through phases, as Derek mentioned before. So we'll be starting with those cases that require no more than an overnight stay and have a very low risk of complication. And then every 2 weeks, we will evaluate whether we can move to the next phase, which would be stays up to 48 hours, and then eventually even all of the rest of our cases from there. So doctors will be able to start scheduling that first phase of cases that only require an overnight stay. They can start scheduling that as soon as April 28th for a May 4th surgery. And then whether we move on to the next phase, all of the phases will have those 3 variables. So we will be screening all of the scheduled electives. And then if the surgeon decides or the physician decides, that could result in an advanced test. Not all of them will have an advanced test, but some of them will. And then for those who will be coming into to Bryan to have that surgery, we'll have separation. So a lot of separation, and that's important for everybody. That separation will include going to a separate entrance, which the scheduler will direct each person, will call them and tell them which entrance at which campus to go to. And then when they enter the organization, there will be separate parts of the organization for COVID patients and for non-COVID patients. We call them hot zones and clean zones, and we won't be mixing those. So if you're coming in for an elective surgery, you'll be in a clean zone. We'll have separation of our workforce as well. Those folks who are taking care of our COVID patients are in those isolation areas and will be a different workforce than those folks not taking care of COVID patients. And even many of our own workforce are working remotely. So again, we can keep those necessary separations. And then one that's always very hard is, what about the person bringing the patient in? So we'll be separating the patients and the visitors. And they'll be dropping off those patients at the designated entrance. And then we will have parking lots and areas specifically designated for those folks who'll be waiting for those folks in surgery. And as they're doing that, they will receive, once they go into surgery, hourly updates while they're in surgery and also during recovery. And then they'll be instructed during that time where to go to get their recovery education. So it might be through the phone, it might be at curbside. In the end, this is about safety. So for our patients, safety for our physicians, safety for our staff, we will either scale up or scale down depending on how we can safely project enough PPE, either the N95 or surgical masks in particular, as well as blood, and making sure that the infection rate is decreasing. So as long as that's happening, we'll be scaling up, but we'll scale down if there are spikes and any sign of extenuated risk for patients, physicians, or employees. Of course, all of this being done in cooperation, again, with our partners at St. E's and the Public Health Department.
Thank you so much, Russ. I mean, thank you both, Derek and Russ, for the incredible thoughtful leadership and preparations, the way that you've worked together and with so many across our community to innovate and adapt to the needs of this pandemic and to continue to provide excellent care. We are so grateful to you. And we're really fortunate that the relationships and systems in place long before anyone had even heard of COVID-19 have served us so well as these leaders and their teams in the wider medical community, convened by the Lincoln Lancaster County Health Department, have mounted just a tremendous response to the challenges that we all face. And again, we want to thank the people of Lincoln and Lancaster County for so responsibly reacting to the threat of the novel coronavirus. The non-pharmaceutical interventions that our community had undertaken obviously have worked well. They've bought us a lot of time to prepare and have helped prevent our hospitals from becoming overburdened. And as we move forward into the future and with any relaxations of our directed health measures, we will continue to work with our partners to monitor the capacity of our healthcare system. And all of us have a responsibility to be vigilant in our efforts to create barriers between the virus and all of our residents. And now for some good news. Don't forget that today is Takeout Tuesday, and if you're able to support our local businesses, please consider ordering some food from your favorite restaurant, enjoy a meal with your family, or maybe even some dessert. I just learned today that the cookie company does takeout, so you might want to keep that in mind. And finally, today and throughout the weeks that we have been doing these daily briefings, the excellent work of our Lincoln and Lancaster County Health Department has been on full display. And I want to again acknowledge their hard work and their dedication. Our community is so grateful to them for their leadership. And my other good news today is that some members of our community have made that visibly clear to the department by drawing messages of hope and thanks with chalk on the sidewalks surrounding the health department offices. I know we've got some images here to share with you. I'm personally grateful to each and every one of our city team who are navigating this crisis with such determination and grace and hard work. And now we'd like to open up for questions. Any questions from the media today?
Riley Johnson with the Journal Star. I'll take the first one.
Sure. Thanks, Riley.
Has there been any, as there's been talk in the state now and in Lincoln about approaching this May 6th end of directive health measure and the changes coming next week, May 4th, in other parts of the state, do you have any concerns, Mayor or Director Lopez, for that message of staying home and kind of minimizing trips into the community as people are getting further now into this first period of social distancing?
We have had some great conversations. Just had a great conversation today with the governor and Director Lopez and myself. And we are, of course, all continuing to emphasize how important it is to stay home as much as possible throughout the month of April. And as we move into May, again, we'll continue to monitor. And, you know, These physical distancing measures are going to be with us for a very long time. They are going to be necessary until there is a vaccine, in particular for our most vulnerable residents. We're going to want our most vulnerable residents, our older folks, and those with underlying medical conditions like heart disease, lung disease, or diabetes. They're going to need to stay home even longer until there is a vaccine. They're more at risk as long as there is this novel pathogen in our community. And we're grateful to all the researchers who are working diligently and around the clock to try to develop antiviral treatments, to develop a vaccination that can be developed and spread more widely throughout our country. That's, of course, going to be key to successfully moving away from some of these more significant social distancing measures that we'll need to be continuing to employ to protect each other and prevent the spread of COVID-19. Are there any other questions for Director Lopez or Jesse, healthcare systems leaders? We have two okay. Here. Go ahead.
It's probably for you, Mayor. Brent at Channel 8 would like to know if you had any discussions or made any plans for a task force for theater and performing arts groups to help them get back on their feet.
The question about a plan for a task force for theater or arts groups to help them get back on their feet. You know, we're thinking about all of our residents and all of the folks who've been impacted by the pandemic. And there is discussion right now about putting together our economic recovery task force. And, you know, we've been highlighting some of the work that folks are doing to support our local artists, whether that's our Lincoln Strong group that's helping to convene artists' performances on Thursday nights, or the Billboard Project that Public Art Lincoln has helped to support to put artists to work who want to display their art publicly and earn a little bit of money during this time when it is so difficult. We are definitely thinking about our artists and all of our residents and employees who are having to adapt because of the changes that this pandemic has created for our local economy. And was there a second question?
This one will probably be for Pat. This is from Andrew at Channel 7. And he's asking, with all the outbreaks at meat processing centers across the state and in the country, wouldn't it be prudent to test workers at the Smithfield plant before an outbreak happens there? And he is asking if there's anything preventing you from doing preemptive tests for the other workers, even though there's only been one case that he mentioned so far.
So you're talking about the Smithfield plant in Lincoln. We're monitoring everyone there for any symptoms, and we've offered testing for them. It's available to them. They can have testing at any time when their symptoms. We're also, those that were working closely with the individual are in quarantine right now, and testing's available to them. Right now, we're not sure with asymptomatic testing, the value of that may not be, the efficacy may not warrant doing that. But be rest assured that they have strong control measures available at the Smithfield plant in Lincoln.
We have a question from Lynn Fisher at KZUM. She asked, is there a timeline for every type of business to open?
I think right now what we've seen, what the governor's shared, he's talked about different businesses, and today at his press conference, he talked about restaurants specifically. That's probably that and bars. You know, we haven't closed any businesses in Lincoln. We've encouraged people as much as possible to telework, and we're still going to encourage that as much as possible. So our restaurants and bars are hair salons, barbershops, tattoo, and massage. And the governor, from his discussion, seems to be discussing those all together.
This is Bill with 1011. Quick question. I understand yesterday you mentioned that testing capacity would go from 150 to 300 later this week. Yet we're still seeing, I mean, today's numbers or yesterday's numbers have been the highest we've seen so far with 80% of that capacity. Are there any ideas or any efforts into trying to bring more people in to get tested? I know you keep hammering home the message, but those numbers are kind of staying a little flat.
We are working on that, and especially now that we have testing capacity up to 300. And we have a meeting tomorrow, actually, to discuss some other locations where we could increase testing. We've been working with our cultural centers and others to talk about ways that we can make it more comfortable for individuals to access the testing at different locations in the city. So, Bill, you'll be hearing more about that probably by the end of the week as we move forward. Helping out in Crete, Brian Health is out there again today doing testing, which is very beneficial for our Lincoln community as well.
Are there any further questions from the media? All right, thank you so much for tuning in, and thank you for doing your part to help us fight this disease and the novel coronavirus here in our community. We'll see you tomorrow at 3:30.